a lot, we need to stand strong for ourselves and for the people around us. It taught us that power of resilience, that vaccines are powerful tools, and that telehealth might become the new normal. Negligence of our mental health is something we humans have been doing time and again. This pandemic helped us unlearn and let go of all the situations which make us uneasy. We will try our very best to help the audience gain as much knowledge and insight as possible from this conference.
Sure, Barina. On this note, we would like to welcome you all to the second International Healthcare Management Conference 2022. Yesterday's conference was a huge success. We are back this year with the theme of navigating the new normal with focus on healthcare accessibility, innovation, and sustainability. We are bigger and better. We had 41 extended abstracts come in this time. Moving ahead, we have amongst us Dr. Prema Basarkekar ma'am, our conference convener, who is currently working as a professor in the areas of economics and entrepreneurship at Somaiya Institute of Management, Mumbai. She has more than 27 years of experience in the field of research and teaching. May I now request ma'am to enlighten us with her thoughts about the conference.
Thank you, Jishnu. Thank you so much. So respected keynote speaker, Mr. Jijo Raju, Director of Somaiya Institute of Management, Dr. Monica Khanna, other dignitaries, research scholars, and conference delegates, and my dear students. A very warm welcome in otherwise chilly weather in various parts of the country and other countries from where all of us have joined today. I'm here to give you a brief introduction of our second Healthcare International Management Conference 2022. We started our journey of organizing international conferences last year with the confidence and encouragement shown by our director, Dr. Monica Khanna. We are thankful to have good scientific knowledge partners such as Healis Sekhsaria Institute of Public Health and Somaiya Medical College Hospital and Research Center, who willingly associated with us and supported us in navigating, canvassing the conference, helping students write the papers, as well as reviewing the papers. The theme of the first conference was Future of Healthcare Post-COVID-19. Since pandemic forced every one of us to bring healthcare at the center stage and look at its management in terms of delivery, accessibility, sustenance in a completely different manner, we thought it would be a very good starting point to start the academic deliberations. We received very good response from the academia and industry professionals. In all, 29 research papers were presented in the conference. They represented various reputed academic institutions across India. We also received few delegates from other countries, and a special issue on the selected paper was published in Asia Pacific Journal of Healthcare Management in 2021. With so much encouragement received from our delegates and our academic partners, we launched our second International Healthcare Management Conference on a higher note. We also formed one more academic alliance with New Jersey City University, Public University, New Jersey, USA for this conference. Keeping in mind changing healthcare sector, we selected the theme of navigating the new normal with focus on healthcare accessibility, innovation, and sustainability. The new normal post-COVID-19 situation poses a lot of challenges as well as opportunities in healthcare sector. Enhancing the reach of healthcare to the weaker section and vulnerable section, identifying the gaps between public sector and private healthcare services, bridging them, and making the organization sustainable at the same time requires a lot of support of new technologies and new innovative solutions. We have received a good number of research papers focusing on these issues. We have received more than 40 abstracts which show increasing confidence in our research conference and in our organization. This year, we have received contributions from various reputed organizations such as IIMHMR, University Jaipur, Doon Business School, Heidelberg Institute of Global Health, Northern University Bangladesh, University of Hyderabad, Lilo Institute of Business Administration, Dental Institute, RIMS Ranchi, Ford School of Management, etc., to name a few. The theme is divided into 7 sub-themes such as: first, managing human resources in healthcare, patient behavior and caregiving, public healthcare, using technology for effective healthcare, preventive healthcare, entrepreneurship and innovation in healthcare, healthcare marketing and consumer behavior. The papers will get presented and discussed in respective 7 tracks. The afternoon session, which will start at 3 p.m., will have an insightful panel discussion on the theme COVID-19 vaccination, the road to recovery, which will be moderated by Dr. Pramod Prabhakaran and the healthcare practitioners from various countries of India, UK, and Belgium will throw light on country strategies, challenges in vaccination drive. Valedictory guest of honor, Dr. Catherine Kariga from New Jersey City University will speak on challenges of health accessibility in public healthcare with specific reference to vulnerable section of the society. This year, we have also received a very good response from the student case study presentation competition. The winners of the case study and the best research awardees will also be announced in this valedictory function. As in the last case last year, we also have a collaboration with Asia Pacific Journal of Health Management and Business Perspective and Research Sage publication. Both the journals are listed in category C in ABDC list 2019, indexed and by Scopus. We will send another mail to all the authors shortly regarding submission of full paper if they wish to submit it for the special issue of Asia Pacific Journal of Health Management. We hope that our delegates and research scholars will gain a new insight from this conference, which will help in taking this research in the healthcare sector at a higher level. Thank you very much once again, and all the best to the paper presenters. Thank you, and over to you, Barira and Jishnu.
Thank you so much, ma'am. Thank you for sharing your thoughts with us. May I now take this golden opportunity to invite our Chancellor, Shri Somaiya Sir, who completed his education from Harvard University in Master of Public Administration and went on to pursue an MBA from Cornell University in the year 93 and has been conferred upon with awards such as American Institute of Chemists Award, American Institute of Chemical Engineering, and Award for Scholastic Achievement. May I now request Sir to speak a few words.
I'm actually here as a listener. Thank you very much for giving me this opportunity to speak, but I'm honestly here as a listener. I wish the conference the very best. I think it's very timely to be discussing issues that we are today. I think it's important to have management of healthcare such that it has a great value in terms of both public health as well as in the curative system, in the science of the medicine to find a cure, in the public health of what whether, and the research on whether it is inequalities, whether inequalities between nations, inequalities inside a nation, inequalities within society that amplify the effect of a pandemic or any other such public effects that come. But honestly, I was here to listen. I was not expecting to be placed on a spot here. I wish the conference great success, and I would continue to participate as a listener. Thank you so much. All the best.
Thank you so much, sir. Thank you for taking out your time to do this, sir. Over to you, Barira.
Moving on, let me please take this opportunity to introduce Monica ma'am, Director, KJ Somaiya Institute of Management, who is an experienced academician and professional expert with around 29 years of experience in academic teaching, research, and industry. She has been acting as a motivator and guiding spirit for us to launch international conferences and supporting us in each and every way. Ma'am has also won several awards, the most recent one being the YK Bhushan Award for 100 Most Dedicated Teachers of India. We would like to invite ma'am to say a few words and deliver the inaugural address.
Thank you so much. It's indeed my proud privilege to be present here for the second International Healthcare Conference. On behalf of the Honorable Chancellor of Somaiya Vidyavihar University, Samir Somaiya sir, our Vice Chancellor, Registrar of the University, and all the conference organizers, the program coordinators and co-coordinators. I really take this opportunity to welcome all of you for this wonderful conference. In fact, I want to really congratulate the entire conference team for having put this together and taken so much efforts to go out of the way and see to it that there are international speakers and delegates for this conference. This is just the second conference, and I think it's really wonderful in the manner in which the entire discipline at the Somaiya Vidyavihar is taking shape. I think disciplines grow when there are debates, when there are discussions, when there are like-minded individuals that come on a particular platform and discuss various issues. And I think this is how the healthcare management discipline is going to grow in the years to come. So my hearty congratulations to all of you. And I'm sure in the years to come, this is going to become better and better. And we as a university and as an institute, we are going to become an important center for not only collating this information on healthcare management, but also disseminating the knowledge on healthcare management. So I came across a very interesting quote by Peter Drucker, and he says that long-range planning does not deal with the future decisions, but with the future of the present decisions. And I think in the healthcare arena, we are on the right track. There was another interesting article that I read, and in a pre-pandemic article that came in the Indian Healthcare, the Needs and Demands, that appeared in the Express Healthcare. It was by Akanki Sharma, and it was dated 14th Jan 2020. This was before the pandemic struck. And in that article, Dr. Ramakant Panda, he is the cardiovascular thoracic surgeon and vice chairman of the Asian Heart Institute. He had a view that the current state of healthcare in India, and I'm sure this is true of South Asia and many other countries, it is a triple crisis of access, affordability, and apathy. The pandemic that started just a few months later in March 2020, and it's even on till date, exposed the state of unpreparedness of healthcare in India and around the world, and its inability to handle such large-scale human crisis situations. The need of the hour is building a healthcare ecosystem that educates common people on the importance of preventive healthcare management, training local volunteers with first aid knowledge to help tide sudden crisis situations, and creating low-cost, innovative solutions for helping the cause of affordability in healthcare. At the same time, it is important to educate the population on their rights to information, on the type of quality of medical care that is being provided to them. The entire healthcare value chain delivery system needs to be relooked at and modernized through the use of appropriate human-computer interfaces along the entire value chain. Inspiration should be taken from the successful launch of Operation Flood, also called as the White Revolution, that was launched on 13 Jan 1970 to create the world's largest dairy development program and a landmark project of India's National Dairy Development Board. It transformed India from a milk-deficient nation to the world's largest milk producer in the world under the leadership of Dr. Verghese Kurian. This was possible by gathering the local farmers and converting them into cooperatives, bringing hope and economic progress into their lives through the use of local resources. Similarly, it is time to create a visionary roadmap to create the white coat revolution in India and around the world that would pave the way for India to emerge and as one of the best healthcare governed countries in the world. India has always thrown up world leaders in moments of crisis, and I'm sure there will be an emergence of such revolutionary leaders in the healthcare sector in the times to come. And I'm sure Somaiya Vidyavihar is also going to show and lead the way. With trained healthcare management professionals and the use of appropriate use of technology interventions, the future is full of possibilities in the areas of healthcare accessibility, innovation, and sustainability. So this second International Healthcare Conference, which has been organized by the MBA Healthcare Management students and the faculty, the department actually, at KJ Somaiya Institute of Management, along with its academic partners and practitioner collaborators, KJ Somaiya Hospital and Research Center in Mumbai, the Healis Sekhsaria Institute of Public Health in Navi Mumbai, and the New Jersey City University, USA. So conference has attracted very good participation, and today we have delegates from Bangladesh and other countries also. So, and the tie-up with the prominent journals for publication of this research papers further establishes the credibility of the conference and the quality of research papers that it is attracting. So once again, I want to congratulate all of you, the organizing team, and hope that this conference will become better and better over the years to come. I wish great learning moments to the conference organizers and delegates and important lessons for the participants and observers. And lastly, but not the least, I want to thank Sameer sir, the Chancellor of the Somaiya Vidya University, for gracing and coming here for this conference. Thank you so much and welcome to all of you. Thank you.
Thank you so much, ma'am, for your gracious presence and constant guidance.
Thank you.
With this, I would like to take this golden opportunity to introduce Mr. Jijo Raju sir, who is currently the Associate Vice President at Alkem Laboratories Ltd, a renowned pharmaceutical company with the belief of extended life care beyond boundaries. The pharmaceutical company stands at completing a striking distance of 5 decades of redefining rules, empowering innovations, and transforming the world. Mr. Jijo is an experienced marketing manager with a demonstrated history of working in the pharmaceuticals industry. He previously worked as the Director of Sales and Marketing at Cipla. Mr. Raju dedicated 16 years of his precious time at Cipla, upholding several roles, including Product Manager, Marketing Manager, and Head of Marketing and Sales Department. Mr. Raju has an extensive amount of knowledge under his belt, which ranges from marketing, brand management, product innovation and strategy implementation to healthcare management, etc. The stage is all yours, sir.
Am I audible? Is my voice clear?
Yes, sir. Yes, sir.
Okay. Thanks a lot, Jishnu, for that lovely introduction. You can call me Jijo, that's not an issue. So, first of all, a very warm welcome to all the delegates who are there, and thanks a ton to the Somaiya management team for welcoming me for as a keynote speaker for this International Healthcare Conference. I'll not take much time. It's a small presentation which I have made, which talks about, because I felt that the topic was very relevant. I think so. What the Chancellor, what Monica ma'am was talking about, that today, what COVID did to the Indian healthcare actually fast-tracked the whole growth of Indian healthcare and our perspective towards Indian healthcare. So the topic was very well written, navigating in the new normal, because the new normal actually is far, far, far different from what even the people like me who are in the pharmaceutical industry, who are in the healthcare management, never thought that the industry would change like this. And I think so there are many jokes, many memes around that what actually transformed India into a digital country, it was no technology, it was COVID which transformed, and it had the same impact on healthcare. So I'll share my presentation and I'll not take more than 10 to 15 minutes, which will emphasize basically, because I've kept the students in mind that for you, how should you look at healthcare in the coming time? What are the opportunities for you? So when I was taking a download from Poonam, I understood that it is basically that all of you who are sitting there, how you should pursue that healthcare in the coming time would be. So there may be some skills which you have learned in your MBA school, but you parallelly need to acquire newer skills to make sure that you are able to navigate in the new normal. That will make sure you're emerging as a leader in this category. Jishnu, if you can, I'm sharing my screen.
Yes, sir. Yes, sir.
It says the host have disabled me not to share the screen. So
yes, sir. We'll enable that. Team, please look into that.
Done.
Great, I got it. Thank you. Yeah, I hope you're able to see my screen.
Yes, sir.
Yes, sir.
Okay. So look, the beauty of this is today I'm sitting at home and able to take you through this, but I am as a person, I believe in one-to-one meeting and teaching one-to-one because that is more interactive. But let me start with, look, for all of you. This presentation won't be very heavy. Don't worry about that. What is our understanding of healthcare? When healthcare as a word in India is said, normally, if it had been open session, I would have asked all of you, but healthcare in India is doctors, patients, pharma, hospital. I was asking Poonam yesterday that which type of companies come in for placement? Where do students want to go after completing a healthcare management degree from Somaiya or any other college? I go to many colleges for placement. Everyone wants to join the pharma. Everyone wants to join hospital or public healthcare sector. But that's what healthcare was before COVID. My presentation today would emphasize how this have changed. Is healthcare today also about pharma, medicine, patient, and doctor, or is it beyond that? So, for me, I'm just giving this perspective from my point of view. Last 2 years, when it was completely for healthcare, it was working from home. It was not about medicine. Frankly, I felt like I was a guy who was working in a technology company. It was about Zoom. It was about collaborating with e-pharmacies. It was collaborating with healthcare companies who are able to reach out to the patient. It was about collaborating with government. You won't believe pharmas today are working close with government. I don't know how many of you know, company like Flipkart have invested in healthcare and bought in a chain of pharmacy called as Sekhsaria in Calcutta. So today, healthcare, you will not find any of these 6 entities which I mentioned here apart from the e-pharmacy. E-pharmacy is also nothing to do with medicine. They are a technology company. So today, healthcare in the new normal is nothing to do with a doctor, a hospital, or a patient. Today, healthcare is more to do with what I think so the chancellors have very rightly said, with technology, how the inequality in the healthcare can be bought in and the patients can be served, or the healthcare can reach more number of people. So from last 2 years, the healthcare industry itself, when I say healthcare, prima facie, the hospital, the pharma, the diagnostic, everyone is trying to make sure how they can optimize. Otherwise, the industry would have collapsed. For all of you, just a snapshot of where do we sit. You have selected, all the students who are there, you have selected to be in the healthcare. And if I take a map out the whole industries, all the industries which are present in the, which we are consumers of, be it IT, be it telecom, based on demand and the disruption model, healthcare was always very high on demand, but never on very high on disruption. You won't believe what COVID have done. COVID have made sure that healthcare today is high on demand and high on disruption. So all of you who are sitting there who want to build their career in healthcare, you are on a sweet spot. This 5 years, 10 years back used to be the position of IT. Any people used to prefer to, after doing your 12th, I was among those 10 years, 17 years back, the parents would push to make sure you're going and doing your engineering and you're going your, particularly, you get into field where you can make money. I think so. Today, all of you who have selected to be in healthcare, pursue your career, you're in a sweet spot because this is where the industry, or this is the industry which is high on growth, high on disruption, which is high on demand. So all of you are on the right spot, and that's why. And particularly, I take a moment and tell you, when I've been in healthcare for 17 years, one of the key things when you're in healthcare, this job parallelly gives you a satisfaction because your work actually helps an individual to lead a better life. So you're in a place which is high on demand, high on disruption. Parallelly, there's a satisfaction that your work is helping people to lead a better life. So for all of you, we are in a market which is disrupting, but parallelly with this disruption, we are able to bring a lot of change in people's life. So you can sleep peacefully wherever you go, even if there is high stress, because your work will help someone lead a better life. So it's a market which is on a sweet spot with a higher purpose. I frankly feel that every individual who has taken up a professional career should have a higher purpose in life, and healthcare gives you that higher purpose in life. And particularly COVID is making sure, and the new normal is making sure that healthcare is disrupting also today, which was very low. Particularly when I looked at healthcare 5 years back, typically I used to get answers from my seniors, from the doctor, kuch nahi hoga, ye aisa hi chalega. That's not the answer today. The doctors have changed, the traditional thought processes have gone out. Now, like I remember one of the teacher was talking about, professor was talking about that, what are the impact on the healthcare? So if it is in a sweet spot today, why it is in the sweet spot? Because I think so the Indian healthcare industry itself was able to stand upfront and address all the challenges which it faced. You won't believe, like the chancellor sir very rightly said, the Indian healthcare system is also overburdened. Today we know that they're not sufficient. Primary healthcare centers, secondary healthcare centers. Means when I do patient funneling for certain categories, that means when we design that any product which is coming, how many patients it would reach. Normally 70% of the patients in India get dropped off. I'm just giving you a number. Say in India, there are around 10 crore patients who suffer from asthma, COPD. But we say there are only 3 crore patients who have access to medicine. That means they have healthcare which reaches them. Now, imagine that was the condition of our healthcare. There was parallelly in the COVID, there was challenges to supply chain. China suddenly increased the price of APIs. The products would have become costly. Patients were not able to reach to the healthcare professional. And parallelly, the typical Indian healthcare market, a very one-to-one market. That means it was more a B2B. Even for pharma, it would go to a doctor detail. Parallelly, for a hospital, it will come to a doctor to make sure their networks are working so that the patient goes into the hospital. It was very one-to-one marketing driven. How did the market react? You won't believe the market reacted at a speed. Innovation happened. The innovation happened at the speed of what could have happened in 10 years. You can today see automations happening across hospital, across healthcare chains. Virtual access of patients. Today, I don't know how many of you believe, big hospital chains have a virtual clinic or a satellite clinic where a rural patient can reach out to a corporate hospital or chain of hospitals and make sure they are managed. There are point of care devices which are coming, which corporate hospitals are investing to make sure that the healthcare accessibility is better. Supply chain. The government today had made sure that the supply chain, and parallelly, there are newer models in supply chain. That itself is a big topic which I not like to touch right now. That how the supply chain have made sure that there is disruption for better supplies and better reach of medicine. And parallelly, technology, if I today look at technology, is answering a lot of questions which are related to how the marketing is done. If earlier, and in my coming slide, I'll surely tell this. In the earlier time, we used to say the healthcare marketing is all about meeting the customer one-to-one. You won't believe today it has fallen down by 30%. Many customers don't want to meet. It is virtually meeting the doctor. It is virtually convincing on the new tool which you have or the new product which you have. So technology is playing a huge role to disrupt this whole market. So if that is what was the challenge and that is how healthcare have addressed it, are there any trends which you can see? So that is about the market. But did you see any trends in the market which is emerging, because of which the whole market may not look like only a market where you have aspiration to join a pharma, you have aspirations to join a hospital, you have aspiration to join a corporate or an IT company where basically it is a lot of data churning and pharmacovigilance work which is happening. If I would like to call out one emerging trend which is there, which is the customer centric. Look, any market, any category, the change is bought in by the customer. The end consumer brings in the change. If I want to talk about one trend which is changing, what COVID actually have brought in amongst the end consumer, that is this slide. If all of you want to take note that why this industry is going to disrupt, why this industry is going to attract more attention of every individual, every other segment, is because in India, which is one of the biggest economies or the biggest, the country with the highest amount of people, consumers, till yesterday, before COVID, healthcare was an expense. I remember, or I know many people that we used to talk about, including me, we used to talk about we have to save so that when we are unwell, we will spend, or we can make sure we can cover up for during that time. So we used to be an economy where we are talking about healthcare as an expense. Whereas when you go to the Western world, it is not healthcare is not an expense. People invest on health. People invest to be healthy. So in India, one change which we are seeing that in India, it is healthcare is not only illness. Healthcare have today become a category where the end consumer want to invest. That means people really want to be healthy, because COVID taught us that if you are weak, if your immunity is down, you are prone to more diseases. You are prone to more such pandemic infections. I think so. It was very clear the highest the category which grew in COVID was the wellness category. When I say wellness, multivitamins, immuno boosters, all those products. So the Indian market, now the consumer have become more conscious and want to be healthy. If in India, the consumer want to be more healthy, I think so that itself changes the whole prospect of the market. Otherwise, that's why I started with, for students, the market, or for any healthcare enthusiast or professional, healthcare was only about, okay, I will go to a corporate, I will go to a pharma, I will go to a corporate hospital, or I will join the primary healthcare network, or I'll make sure that I will work amongst these 2-3 categories to make sure I'm bringing the change. But today, the landscape is changing. When I say this, the numbers itself tell you that how this landscape is changing. I'll not read out the number, but look at what is the size of Indian pharmaceutical market or pharmaceutical market. There's the whole Indian healthcare sector. We're talking about a $372 billion market. The numbers are not important, but you look at the right side, you will find there is not a single category which have a CAGR growth of more double digits. Hospitals, we can understand. Hospitals are 16 to 17% CAGR. But look at health insurance, which was a neglected area. Health insurance at a 16 to 17% CAGR. Medical equipment at a 27% CAGR. Diagnostics at a 27% CAGR. Pharma, which was hit by COVID, a lot of category which grew, but still pharma at a 17% CAGR growth. That tells that in India, people, the mindset of the end consumer is changing. And why it is changing? If one slide I would like to emphasize particularly, how the healthcare system used to be before COVID. The healthcare system used to be COVID. What are the major segments? We were talking about hospitals, we were talking about pharma, we were talking about they were not talking to each other. Pharma was center to everything, and the pharma was talking to the patient, physician, and the government, influencing government policy. Digital was only about, if I take only hospitals key customer used to be the pharma, the paramedic, the pharmacy. But today, or let us take the doctor. For doctor, there were only 2 people. He was connected to the patient, but he was more concerned with the pharma and the physician, because he writes for pharma products and parallelly he listens to the physicians association to understand that what are the new norms, how I should, or basically waits from the physicians association to get an update to make sure that he practices as per the guidelines from the physicians association. But how did it change? When I look today, the new normal, which is we are talking about, how is the healthcare navigated? Today you'll find technology. In the previous slide, you could see technology was at the far end. Healthcare where technology was nowhere in the center of it. You can say today, because of technology, the pharma is directly for pharma. Many of the pharma companies are betting big on this technology. Diagnostics, physics, all are now interconnected. Everyone is talking to each other. Suddenly the payers, means the insurance companies, have become important. Digital technology have become important. Diagnostics, because we are worried, we want to make sure that we are healthy. Diagnostics have become important, and everyone is talking to each other. You look at how empowered the patient and the end consumer is. I think the COVID made one more thing, that the end consumer is more aware, and end consumer knows what he wants. And wherever consumer awareness is high, be it pharma, be it FMCG, automatically that category grows. And a small, if I say this is how the landscape of healthcare have changed, just how the behaviors in this landscape have changed. Let us take the consumer engagement. That is for pharma. Let us take pharma as a case study in healthcare itself. 100% of work used to happen. Consumer engagement meant we have to go meet the doctor and the sales happen. You won't believe today there is 40% digital calls happening. Pharma used to believe the more number of people, the more sales would happen. Today, pharma is making sure that if you are budgeted 100 rupees for sales, 30% of that would be for digital reach out. Pharma, which was so rudimentary in terms of thought process, it never thought digital would disrupt. Today, 30% of monies are kept in for making sure their outreach to the doctor is digital. Channel. Till yesterday, when I say channel, for all of you to understand, channel is the chemist and the stockist model, which makes sure the medicine reaches the end consumer. It was a very hub and spoke model. It was a model where very linear model. But today, there are newer propositions which are coming, newer platform, how technology is disrupting. That itself can be a new area where people can build in career. I have a friend who recently started, 5 years back he started, but in COVID, the company's valuation from 5 crore went on to become a 200 crore company, and his role was only to make sure how in channel disruption can happen. And in India, channel is a very big thing. I don't know how many of you know India have around 7 lakh, 8 lakh pharmacists who are there, but you won't believe out of that 7 lakh, 8 lakh, nearly 50% of pharmacists don't have any doctors attached. They themselves dispense medicine to the patient, because for those patients, example, a rural belt, I stay in Thane, we go close to Thane, any rural belt close to Thane, there would be a chemist, but it's not necessary there have to be the doctor. The chemist acts as a doctor in those categories. So how we can bring them together and make sure they are more efficient in the system. So that's how the disruption is happening. You can see in every category which was very traditional, a 40% consolidation is happening in terms of use of digital technology, use of data science to make sure that these segments are disrupted. So if I want to summarize my whole talk and say, 2 years back, if for all of you, the landscape of healthcare, or for you, if you looked at healthcare, it was about pharmaceutical company, hospitals, IT companies, CROs. If those were the companies which are managing the healthcare system in India, or those were the places where you would go in the emerging new normal, how does the landscape look like? This one slide summarizes it all. We are talking about 1,200 startups in India and in different categories. You won't believe, none of these companies, the e-pharmacies, EMR, today doctor-patient record or the patient record have become a key thing. Deep tech. I'm particularly working with a company called Credible, which is here on the healthy eye tech. The HRCT reports which come, the data is collated and the machine would be able to predict disease much before the doctor. B2B telemedicine, you look at online teleconsultation, e-diagnostic, and you will find none of these 10 categories which I'm talking about makes medicine. None of these 10 categories which I'm talking about is about doctor. It is about end consumer. How, I think so, the Chancellor said it very well, how in healthcare the equalities can be managed, inequalities can be managed, and it can reach people. How with data the consumer can be served well and make sure, as I said, it is more about, you look at the bottom line there, personal health management. I told you the market is moving from illness to wellness, people's mentality. Look at personal care, or in care itself, care category itself is growing at a pace of 100% plus. So for all the youngsters who are sitting there, it's not today, healthcare is not only about, I'm not saying it is anywhere against, I myself am a pharmaceutical professional, but it's not, I'm not saying it's only, you have to increase your horizons, and these are the new opportunities which are opening up, and this is how you can contribute and make sure that the healthcare or the whole Indian healthcare is changing. If I want to bifurcate those companies and divide, just tell you that how does these look like? You look like today there is a big run to make sure who's winning the telehealth. Diagnostic and pharmacy, that is a big change. So the 4 vertical, how it looks like, if I want to summarize all of that, remote care. Look at, I'm not talking about illness, I'm talking about remote care as a category which is coming up. Hospitals are consolidating today. It's not about multiple hospitals. Apollo is buying in a lot, Global is buying in a lot of existing hospitals, and they are consolidating and making sure the reach is better. And one more category which you will find is emerging where healthcare professional can make an impact is healthcare finance, which is healthcare insurance. Today, when I look at, I interact with a lot of companies which are in this category. These are run by engineers. These are not, there are not much healthcare professionals. So what would be your role in these new emerging sector? You understand healthcare, you would be able to decode and work well and create synergies there. So that's why they require today a lot of these companies. When I look at, I just give you an example of a company called Credible, which is into diagnostics, and that too, they don't have a single HRCT machine, but they make sure from HRCT result which comes from their software, what are the probable disease a patient can get. but all of them are IT professionals. They are IIT Madras students who understood that there's a need and converted this into an opportunity. But that's where the healthcare management students role comes. You understand healthcare, you decode it, and you can make sure these newer opportunities which are coming, how can we make sure that it can be, this grows at a faster pace. And already bigger companies, and what is better for all of us, even those businesses are getting consolidated. When you look at today, Jio is getting into healthcare with Jio Health Hub, but parallelly they have acquired something in e-pharmacy, NetMeds they have acquired in diagnostics, they have acquired Theranom, we are talking about Reliance Hospital, we have acquired Fortier. Everyone is trying to vertically integrate and make sure that it is a consolidated game which they are playing, be Tata. So Tata and Jio is there, you can understand how healthcare, this was not an interest area of anyone 5 years back or 3 years back. So what is the new normal have happened? The healthcare suddenly have disrupted, and none of them, when I show this, none of them are talking about making medicine. None of them are talking about creating more doctors. It is about how inequalities can be managed, how the reach can be better, how the patient can be served better, and make sure that this market grows well. So with that, I conclude that in navigating in the new normal, it is not about complaining about COVID, complaining about e-classes. The optimist normally waits for the change, but if you all want to be the leader in this category, you have to adjust and make sure in the new normal you fail. So that's what John Maxwell said. I completely believe, and I think so. The healthcare management in India showed that resilience today. That's why in 2 years' time we were able to do this disruption. So that's from my end, and I'm open for questions. I hope I exceeded my time. Sorry for that.
Wonderful, sir. Thank you so much. That was really insightful. I would kindly request you to announce the unveiling of our compendium of 41 abstracts. IT team, could you please share the screen? And everyone who wants to ask a question, please redirect your questions to Q&A Tanmay Gosavi. Yes, sir.
So,
yeah, just a minute. So could you please announce the unveiling of our compendium, e-compendium? Hello, am I audible?
Yes, very well. Yeah.
Mr. Raju, sir?
So you just have to say that the compendium is unveiled.
Okay,
yeah.
so thanks. So sorry for that. So
No problem.
from my end,
Yeah,
the compendium is unveiled, and I open this compendium for everyone. Please make sure that we use best of this.
Yes,
Thank you so much, sir.
So there are 41 papers, abstracts are there, sir, and we'll definitely send you the soft copy.
Thanks a lot. Thanks a lot, Timaman.
Tanmay, please go ahead.
So first question we have is how can the health innovation community best contribute to fighting the spread of COVID-19?
Okay, so the question is about how can healthcare innovation companies fight the spread of COVID more. I think so there is this task is more taken by the government to make sure that there is more awareness, because spread of COVID can only be stopped if there is more awareness. You won't believe that I travel in today's date also, wherever the government, example, when I look at a southern state like Kerala, you enter and you will not find an individual without mask. So the government of here, because it's not about innovative something, there can be innovation in terms of communication. It's more about emphasis from the government to make sure that what standard norms people have to follow to make sure that the spreading is not there. So it's more to do with the government and the private sector coming together to make sure that they're educating people that what are the right measures to make sure the spreading don't happen. I think so. Education is the only solution, and private and government together should come up and make sure they take this hand in hand to educate people. Because I today also feel a lot of rural town people not wearing masks. People are not aware about. People know COVID, but they're not taking it seriously. I'll give you a simple example. I was in Varanasi. I was talking to my driver. I asked him, why is he not wearing the mask? His simple answer was, "Jo kamzor the wo guzar gaye." That's a very wrong thought which people have. He thinks that he will not get affected. So COVID only affected people who are weak. And when I asked him, he had 5 members in family who passed away. So it is all about education. So if COVID had to be stopped, it is not something, and I frankly feel, I talked to a lot of virologists. We recently had a webinar with the leading Dr. Nagwekar, who's a leading virologist, to understand the virus very well. It is not that the pandemic is not, this virus is going to come again. Like, it is not something like a flu. It may become mild, it may become strong based on how it is mutating. But only thing which healthcare and the government should do, educate and make sure that people follow the norm, people follow what has the right behavior. That's it.
Next question we have is, which trend are you seeing at the large scale in the healthcare industry, and will be there any impact on that trend post SARS-CoV-2 virus period?
Okay, so if I want to decode this question, what is the trend which I'm seeing? I think so in my presentation, I talked about the adoption of digital by the healthcare industry, be it every segment, starting from clinical trials to the supply chain to healthcare management. That's something which is going to impact the healthcare industry. But if I want to decode this question and say which is going to emerge as one of the biggest segments in healthcare. Today in India, as I say, illness is something which companies are focusing on. People are focusing on making money by making sure we are treating ill patients. But one trend which in next 5 years will come in would be making sure we are focusing on wellness. Youngsters, I don't see any youngster sitting here is not worried about her beauty, her or his health, his body. You know, if that is the thing, in the coming time, it is going to be wellness. So if 5 years back in India, illness was a category, today you won't believe what is the amount of money which is spent on wellness as a category. I very strongly believe that wellness as a category would be something which we should look up to. A simple example, decathlon 5 years back, 6 years back, in the whole Bombay, there would be 1 or 2 decathlon. Today, you find decathlon across the city, even in, after every 2 stations, because decathlon, I represent decathlon as the more number of petrol pumps, the more need of cars, or there are more cars on the street. Decathlon is just for everyone to make it that. It tells me how much healthcare enthusiasts exist. You'll go there, you'll find even younger, older, every type of people. So wellness would be a big category. Illness still would remain a big category. But in illness also, the trend would be people's focus would not be on acute management. Chronic categories would be somewhere people would focus more on, or the more money are spent on that category. But all of this would be disrupted shortly with technology.
Thank you so much, sir. We are really grateful to have you with us today.
Thanks, team. I think so. You would have a next session. So thanks a lot. If there are any other questions, you can find me on LinkedIn. I'm on LinkedIn. You can write directly to me on LinkedIn, or on LinkedIn is a more professional platform where you can write to me. I'll answer those questions. No issues. Feel free to connect to me. Only thing, thanks a lot for all of you, for the Somaiya management itself, for welcoming me for as a keynote speaker. Thanks a lot. I think so. The whole team. With that, I'll take say goodbye to all of you. Thanks a lot.
Thank you so much. Thank you so
much.
Thank you,
sir. The pleasure is all ours.
Thank you.
Thank you.
So I can disconnect. Is that fine, Jishnu?
Sir, 2 more minutes, please. Like, we'll have a vote of thanks and then you can disconnect.
Okay.
Thank you. So moving forward, I'd like to now call upon Dr. Poonam Chauhan ma'am, our conference co-convener, who is a faculty in the area of marketing strategy and international business. She has over 20 years of experience, of which 15 years have been in academics, teaching, and research. May I now request ma'am to address us with the vote of thanks.
Thank you so much, Jijo. Respected Mr. Jijo Raju, thank you for taking out your time. And today, I'm sure my students have gained, and all the delegates here, we have gained a lot, understanding how the ecosystem in healthcare is evolving, changing, and with leaders like you, I'm sure we'll be able to navigate this new normal with emphasis on wellness and a startup culture, as you have just shared with us as to the number of startups which are coming up in this particular sector. Thank you so much for taking out your time. I thank our Chancellor, Shri Somaiya sir, for joining us and encouraging us today. Our Vice Chancellor, Shri V. N. Rajshekharan Pillai sir, for their constant support and encouraging us. Our Director, Dr. Monica Khanna ma'am, for helping us every step of the way to make this vision of second International Healthcare Management Conference possible. I thank our knowledge partners, Healis Sekhsaria Institute of Public Health, KJ Somaiya Hospital and Research Center, and New Jersey City University for joining us in this year's conference. I thank our PR team, which is very ably led by Arvind Pandey-Durai, for helping us in all the infrastructure arrangement, along with IT infrastructure team, today supported by Mr. Freeman. Myself and Jaya Matthew are very, very proud to be part of this dynamic team of healthcare management coordinators. We are led by Dr. Prema Basargekar, who leads by example and is extremely dedicated and drives us to achieve much more. Sincere thanks to all my faculty colleagues and delegates for joining us. I greatly appreciate, last but not the least, our entire student volunteer team, ably led by Barira Masood, Jishnu Shaw, and Sejal Agarwal, to make this conference and a lot of hard work in it possible today. I wish all the delegates a great time of deliberation ahead in the breakout rooms and different tracks. And thank you so much for being with us today.
Thank you so much, ma'am. Thank you so much, ma'am. Sir, you may log out now if you wish to. Thank you so much for your presence.
Thanks a lot. Thanks a lot.
Have a great day, sir. We will soon begin with the paper presentation.